Hey guys, what's going on? Erica Lee, Elite Massage Therapy. I'm a PTA, licensed massage therapist, also a certified strength and conditioning specialist. So today in this video, I want to go over how to treat your own runner's knee and patella femoral syndrome. Let's check it out. All right, first, so let's go over what is runner's knee. What is patella femoral syndrome? So basically what happens is your kneecap gets pulled off track because muscles are a little bit tight, usually along the lateral side of the leg, and a little bit weak or maybe even tight on the inner part of the leg. Again, before you get right into digging into any tissue, I like to do a warm-up. So what I got here is just a basic runner stick. You can get this on Amazon or wherever. I like to warm the tissue first, giving it a nice roll. I work the inner part and the outer part of the leg, making sure the tissue gets nice and warm before I really start digging in there. So next we have the foam roll that we're gonna hit. Now I know some of you have probably done some foam rolling in the past. Everybody hates it, but really it's a great way to self-mobilize the tissue and help to get into the tissues where they're really, really tight at. So to begin with, we're gonna get the top of the leg first. All you're gonna do, literally just lay on top of the foam, starting down by the knee, and you're going to roll yourself back and forth here, right? When you get to a spot, again, you might be feeling like road bumps, things like that in there. When you get to that good spot, you're gonna take your leg and flex and straighten, okay? So we're flex and straightening the leg. Again, this is gonna help separate the tissue a little bit better than just rolling itself. And you can, turn one way or the other to kind of hit different points. If you're feeling it, maybe a little bit more to the inner thigh, roll a little bit inwards, or to the outer thigh, roll a little bit outwards, and repeat. Rinse and repeat. Okay, so this next foam roll that you're gonna do is just simply have a seat on the foam roll, turn onto your leg, your affected leg. This is gonna be really slow motion. Okay, so you're gonna start at the hip and move towards the knee. Again, same fashion. If you're feeling any really tight areas, make sure that you stop and allow the tissue, right there. Allow the tissue to unwind a little bit. You can increase the pressure by lifting up one leg. You're getting a little bit more weight on it that way, or decrease the pressure by allowing that leg to drop. So work at your own pace, go nice and slow. Spend a couple minutes here and really look for and find those hot points. Hang out for a minute. So those stretches that we just did on the foam roll, you can also use a tennis ball. So again, most people have a tennis ball. If not, guys, just go on Amazon, buy it, click buy. But same idea, that hot spot that you had, maybe laying on your side, put that tennis ball on it. Now you don't have to be putting full weight on it, so you can lean away or you can lean towards the leg to control the amount of pressure that is going through the tissue. Hold for about 30 seconds on your hot spots, just to allow that tissue along the lateral leg to release in there. Again, we're really focusing the lateral leg because this is where most of the tension is going to be with both runner's knee and patella femoral syndrome. Okay, so let's check out some exercises now that are going to be good for this. We're still going to be using the foam roll, but first let's address the quad itself. Make sure it's going to be firing correctly, okay? So set up for this. You're going to have this leg nice and straight here. If you want, take the tennis ball or a small towel roll. You're going to push the knee down into the ball. So we're tightening, we're firing that quad muscle, okay? You want that quad muscle to get fired up. Squeeze it nice and tight. Hold for about 5 seconds. Return it. Do the same thing again. The heel should be lifting up slightly. If you're not using anything, again, still my heel is lifting up slightly, but I'm getting a nice, strong quad contraction on top. Okay, so this next one, we're gonna just replace the tennis ball with the foam roll. So you're gonna be going through a little bit more range of motion with this. Again, we're gonna make sure we're firing up the quad. Just lifting up that heel, pull the toes back towards you. Always have the toes pulled towards you when you do this exercise or when you're trying to really get a good contraction in the quad, okay? And down slowly. So you shouldn't just be letting it plop down to the floor. Control it up, control it down for a 3 count. So this next one is going to be a series of straight leg raises. The same principle that we're doing with making sure the quad gets fired, you're going to do with these straight leg raises, okay? So again, making sure that the knee is going to be pushed down into the mat. You're going to get a good quad contraction. For this, you probably want to go ahead and lie down a bit further. Get a good quad contraction. When you've got that, raise up no higher than your opposite leg. In fact, below it is even better, and control it back down to the floor. Now, when you do this, I see a lot of times people will get that first quad contraction in there, but then as they go to lift the leg, they unlock the knee and the whole leg comes up with the knee bent. This is wrong, okay? So you want to keep the knee locked out the entire range of the motion, controlling it up and down for a set of 30. Okay, so this next one is really similar. Again, we're gonna get that quad fired up. We're turned onto our hip now. We're gonna do more of a adduction, a deduction of the hip. So we got the quad locked out, the knee locked up, and we're going up and down with our leg, with our toes pointed outwards. All right, so last one of the straight leg raise series here is, again, we're going to keep the knee locked out. With this, though, you're going to make sure you want to have your hip turned forward towards the front of the mat or just towards the floor in general. A lot of times what will happen is when we try to perform this motion, the hip is going to tip back and you're going to end up doing a side leg raise like this, which is incorrect, okay? So you want to keep that hip, push it forward, bring it towards the floor, bring that leg slightly behind you, toes flex towards your nose, raise that leg up, squeeze. You should feel a squeeze in the glutes here, and back down. Nice controlled motion. Again, for about another set of 30. All right, so now that we've got the tissue nice and loose and warmed up and we've gone over our exercises, here are some stretches that you're gonna do for your quad and also for that hamstring, okay? So the first one for the quad you can do in a standing position. All you're gonna do is place your foot on top of a chair or something of that relative height. Keep your knee pointed at the floor. Now, if you need to hang on to a chair, a wall, a countertop, whatever to make it happen, that's what you're gonna do. So a lot of mistakes people do when they do this one, the knee draws forward and that doesn't give you the proper stretch that you need in the quad. So you want to make sure that you've got the leg actually slightly extended behind you, the knee is pointed at the ground, and you are standing up nice and tall. Okay, as soon as you do that in that position, you should feel that stretch all the way up, even through the hip, on down to the knee in the front of the thigh. Now the next one that you're gonna do is just a hamstring stretch. Again, you can do this in a standing position. Putting your leg up on maybe a stair or a chair just like this. You're gonna keep that leg straight, keep your back straight, hinge forward at the hips, and you should get a nice hamstring stretch. It doesn't take much. As long as you've got your back straight, you know, legs straight, toes back towards you, it shouldn't be that far before you start to feel that pull in the back of the leg there. All right, well that does it for how to treat your own runner's knee and patellar femoral syndrome at home. Some other factors that might lead to this would be maybe some hip weakness and tightness, which I'm going to go over in another video. And also there's going to be some taping strategies that I'll help go over with you guys as well. All right guys, I hope you got something out of this. Treat yourself well and I'll talk to you soon.